Okay, good afternoon, everyone. My name is Melinda Irwin. I'm Associate Director for Population Sciences in the Yale Cancer Center. So I'm fortunate to introduce our two speakers today. But before we do so, I just wanted to remind you, I didn't know if gentlemen wanted to say anything about the Yale Innovation Summit on May 8th. This is a spectacular event. Who went to this last year? Raise your hand. Okay, well, you've got to go this year. It's a really spectacular event coming up in about a week and a half. But you can submit a poster application, and here is the information. It's due.
Still accepting posters.
Okay, like that says April 17th.
Posters are still open.
Okay.
First served. There's still some slots left.
Okay, any other comment you want to make?
No, it's a great event. It's all there's 1,000 people there.
Yeah, it really is a phenomenon. So submit it at yaleinnovationsummit.com. Okay, great. Okay, so we have two talks today. The first is Stephen Ma, who's a professor of biostatistics in the Yale School of Public Health. He also directs the Yale Cancer Center Biostatistics and Bioinformatics Shared Resource, which, if you're not aware of that shared resource as well as the other shared resources, make sure you go to the Yale Cancer Center website and read about them. Stephen was trained in statistics at University of Wisconsin at Madison and has been here at Yale for about 15 years and has had multiple NCI studies funded looking at various aspects involved in various number of cancers. I'm not sure which cancers you're going to discuss today, but a number of different cancers as well as some cancer disparities research as well. Thank you.
Many thanks for the introduction, and also it's great pleasure being here. I think I gave a similar presentation maybe, I actually don't remember, maybe 5 years ago. It somehow feels like yesterday. So I'm Stephen, and this is my email. Just a little bit of information on myself. I'm a professor of biostatistics. As Melinda mentioned, I direct our biostatistics shared resource. And I also work directly on skin cancer and also lung cancer. We have two spores. And I have been part of the skin spore for 6-7 years. And I recently joined the lung spore. So for both spores, I direct biostat and bioinformatics core. So if you work on those two type of cancers, you may have or you will directly work with me. So this is a point I want to highlight. So if you need any cancer analytic support, biostatistics, bioinformatics, or anything dealing with numbers which may or may not be classified, talk to me. My office is actually very close to here, just about maybe 5 minutes walking distance. And so you are welcome to stop by, talk to me at any point. And well, this may be the best way to reach me, my email. Usually I respond within 24 hours. So if I don't, well, that means there's something horribly wrong. So check with me. Okay, so who we are one of the shared resources. There are actually a bunch of those shared resources. Actually lost count some time ago, and we are sort of led by Dr. David Stern. He sent me a couple emails saying he's really sorry he can't be here today. He is a Cancer Center Associate Director for Shared Resources. And my shared resource, we are stationed in the Department of Biostatistics and within School of Public Health. And also we are, sort of part of YCAS, stands for Yale Center for Analytic Sciences. So if you work on cancer directly, talk to me. If your research is more related to other type of diseases, diabetes, cardiovascular diseases, anything else, you are also welcome to talk to YCAS. Basically, myself and my team, we do cancer. For anything else, that will be YCAS. So we have been supporting those large team studies like the sports studies, other big grants, but we also work with individual studies. R1 studies are 21, even R3 or pilot studies. So big studies, small studies, talk to us. We will be equally happy to help. So exactly what we do, we provide I don't want to say 100%, but maybe 99% of biostatistical support. And we also do some bioinformatics support. It's, well, sometimes maybe a little bit inconvenient for investigators since there are several bioinformatics groups on campus, including us, including some people in department pathology and other bioinformatics, omics related groups. And actually, I don't know how many are there, but maybe a good idea to start with me. And if we can help you, we will do that. If we cannot, I will direct you to the right person. So, well, not bad idea to start with us. And also we do some data management, especially high-end data management. If you have a bunch of numbers on a paper, you want to put them in an Excel sheet, maybe not a good idea to talk to us. I mean, we can do that, but honestly don't like doing that. But if you have large, complex databases you want to manipulate, talk to us. I mean, we're still building our data management capacity, so we can do some, but maybe not all. Well, again, start with us. So a quick introduction of our team. Myself, my own expertise is genetic epidemiology. So trying to look at what kind of risk factors, genetic, non-genetic, may contribute to cancer. And I also do general biostatistics, simple as logistic regression, linear regression. And we also have Dan Zeltman, who is a professor in biostatistics. He is really a great expert in clinical trial. He also does PRC protocol review. So for designing and analyzing clinical trials, he may be the best resource on campus. We have Ted. Ted has been providing population study support. Also, he is a really worldwide renowned expert in lung cancer. So I think maybe 2 or 3 years ago, he went to the White House. I think maybe longer than that. It should be the last president. So he went to the White House and got some really prestigious award for his work in lung cancer. And we also have Dr. Wei. Wei is here. He is a new assistant professor, also specialized in clinical trial, general biostatistics. He also does part of PRC review. A couple years ago, we brought in Michael, who works in this very specific and, in a sense, very sexy area, biomedical big data. So apparently, if you have this word in your proposal, the odds of getting funded just jump up. So if you have any ideas related to big data, talk to Michael. And Dr. Yang Kong is a research scientist specializing in bioinformatics. And we also have a bunch of master-level biostatisticians who work on a lot of different cancer types, different types of analysis. And I think combined together, they have maybe 25, 30 years of experience. So really experienced statistician. And just a little advertisement, we're also trying to look for a bioinformatician. So if you have any candidate, any of your collaborator, please talk to us. And Lisha is a part-time admin person, so she helps us keeping track of all projects. And I think this is a big advantage we have. We have a huge department of biostatistics. So if you need expertise not covered by us, we can definitely help you build collaborations. Okay, so what we can do and what we have been doing, we can help you design your study. So this is copy-paste from a proposal we recently did. And we wrote this, and we also did this is actually quite fancy plot. So basically, we can tell you where to start, what's the sample size you may need, if it's a clinical trial, do you need any interim analysis, and what the end results will be. So if you do basic science studies, you may or may not need this kind of flowchart or this kind of design. But if you do any study related to human phase 1, phase 2 clinical trials, you definitely need this. So if this is missing or if this is done in a sloppy way, I can pretty much guarantee you your paper or your proposal will be shut down. So talk to us for this kind of thing. And we also provide you analysis plans. So basically try to convince reviewers, NIH, FDA, and other reviewers, we can do the analysis. So we do, well, this kind of biostatistics analysis, like progression-free survival, overall survival. And we also do bioinformatics analysis. So we can tell you if you have RNA-seq data, those are the software packages you need, and those are the steps. So this is for the sake of the proposal and also to convince investigators, to convince reviewers, we can do analytics correctly. So in the middle of the study, we are also there. We want to make sure the study is done correctly, data collected in an unbiased way, and all procedures are followed. So there will be no surprise after data collection. If there is any plan for interim data analysis, we will do that. We will report results. And sometimes the actual results are just different from what you may expect. In this case, we will revisit and revise your data analysis plan if needed. Well, this, believe or not, this happens actually quite commonly. So you do need a very strong, very convincing way to tell NIH, tell FDA, okay, I need to change my data collection and my data analysis plan, and we can do that for you. So well, after your data collection, we will do thorough data analysis. And well, so far, we have been doing two things. The first one is using existing techniques, existing software, so doing biostatistics, bioinformatics analysis in a sort of standard way. And this is what I want to highlight. So if you look at our research profile, our biostat department, we are actually doing quite well. So beyond using existing standard methods and software, we can also develop techniques and software tailored to your study. So your study will be the first to use those cutting-edge, really novel analytical methods. And that can actually help your publication, help your future proposals a lot. So, well, here are some examples of, well, this one is for omics data, genetic genomic. We have been actually in a leading role for those network-based analysis. So instead of looking at individual genes, we now look at genetic networks. And this is a sort of a new add-on technique we recently developed. Well, in pretty much all cancer studies, we have those small slides from biopsies, and there are so many biopsies, biopsy samples, and so many imaging data just there. So we recently started looking at those data and see if we can get more information, for example, for prognosis, for treatment selection, based on imaging data. Well, that's only job half done. We also help you with manuscript, abstract, and posters. So we can write your statistical analysis section like this. We can help you with tables, charts, figures like those. And well, I have been in this business long enough, but I don't think I ever have a paper got accepted without revision. So this will always happen. You always have nasty comments from reviewers. So we will be there for you, address those comments. So, and also we can help you after your study get funded, after your paper get published, just see what else we can do. Can we have additional papers from the same data? Can we have follow-up grant applications? And I have some old data. Well, this is from fiscal year 2017. So this 71, this number is a number of cancer center members we directly work with. Well, just imagine sort of behind each member we directly work with, there's a team. So we interact maybe half or more than half YCC members. And well, this is too small to see, but in slightly over a year, I think we contributed 60, 80, I actually don't remember the number, but a big number of cancer center publications. So I'm actually quite proud we are everywhere in the cancer center. So our policies start with me, start with Alicia. So if you have any idea, have any question, send an email to me, to Alicia, and let me know what we need. And again, usually we respond within 24 hours. If it's something we can do, we will assign a biostatistician or bioinformatician. He or she will schedule a meeting with you, get to know more about your projects, exactly what you need, and also maybe give you an estimated timeline, like we need this number of hours, we can get this done by that time. And if it's beyond our expertise for some bioinformatics, for some data management, we will tell you who to contact. So bottom line is you will have a response. And there will be follow-up meetings. We will have, again, we will have a statistician or bioinformatician assigned to your project. And we will follow up until we have a final product. It can be a poster, a paper, a funded study, or more often a rejected study. So, but anyway, we will work with you until the end. So, well, this is our official policy, and this is written on the website, and this is written in our grant renewal submitted to NCI. So if you have a good idea for a proposal, we will try to contribute as much as you need. And this is a part, item B, this is a part I really like about NCI. They give us, well, not a big amount of money, but enough money for us to provide you this amount of free support. Again, this is free. So for biostatistics, each of you can get up to 16 hours. For bioinformatics, we can provide 8 hours, sometimes more. And for service beyond this limit, officially, we ask for this amount per hour. Let me say two things. First of all, this is much, much lower than outside consultants. So if you want to get someone from a commercial company, this number is much bigger. And also I want to say, myself and my team, we are researchers. So, let me say I like money, but it's not the first thing on my list. So if you have a big idea, but you don't have enough money, still talk to us. We definitely don't want any single paper not published simply because of this. So talk to us. And if you really need a lot of support, but again, if you have a funding problem, we do have an official oversight committee, and they can give us official approval for, well, not asking for money or offering help at a reduced rate. So again, we do have this official policy, but that definitely should not be our biggest concern. So a couple quick remarks. I don't think any cancer paper get published simply because of good statistics. It doesn't happen. But if you have lousy statistics, a bad analysis plan, or sometimes just a bad table, a bad regression model, it it's sufficient to sync your papers and proposals. So let's make sure this does not happen. And also, don't talk to us at last minute. Sometimes I got emails 10 p.m. in the night saying I have a deadline 8 a.m. tomorrow morning, and basically the only thing I can say is good luck. So don't do that. Get us involved early on, and we will be there. So go to my office directly. You're welcome to do that. And my emails, my email, Alicia's email are here. And also you see our list of statisticians. So if you want to talk to anyone specific, do that. So again, we'll be there, and I'll be happy to answer any questions you may have. Thank you.
Any questions? Yeah, so I've been fortunate to use the Cancer Center Biostat shared resource for 15 plus years, and it's true. I mean, you can, if you get a paper, revise and resubmit, and you're lucky, and then if it's not appropriate statistics, it'll get rejected. And so it's really critical to have that biostatistics support, not only in analyses, but also submitting the grant and then once carrying out the study. So please reach out to them if you need their help. Thank you.